the magnitude of OVC in Nigeria really is a major concern.
The Global Fund is one of the states that assisted the ministry in developing the state plan of action for the national priority agenda in Nigeria.
We're able to provide educational support to 5,190 children in total.
It has assisted those children who are orphaned by HIV in the state to have hope for tomorrow, because it has made education interesting for them.
Nigeria has an estimate of 17.5 million orphans and vulnerable children. Over 2 million of these children were orphaned by HIV/AIDS, and about 260,000 of these children are currently living with the HIV virus.
As you are well aware, the magnitude of OVC in Nigeria really is a major concern, not only to the government but also to the citizens of Nigeria. As a recent estimate of the number of OVCs in Nigeria is reckoned to be about 17.5 million orphans and vulnerable children, out of which about almost 3 million are orphaned by HIV/AIDS, and about 260,000 are living with the virus itself currently. This is a major challenge to government.
The federal government of Nigeria has initiated a number of policy frameworks directed at improving the situation of orphans and vulnerable children, OVCs, in the country. These include the passage of the Child Rights Act in 2003, which incorporates the UN Convention on the Rights of the Child, and the development of a 5-year National Working Plan on Orphans and Vulnerable Children, FMWA and SD, in 2006.
I must commend government's efforts from point of view of policy framework that are in place. For example, the Child Acts, which is in line with the UN Convention for the Rights of the Child.
In complementing the efforts made by governments to address the burden of OVCs in Nigeria, several donor agencies such as Global Fund, UNICEF, USAID, and many others have supported the Nigerian government in addressing the issues of orphans and vulnerable children. The Global Fund to fight AIDS, tuberculosis, and malaria has been supporting Nigeria since 2007 to address the issue of orphans and vulnerable children.
The Association for Reproductive and Family Health is one of the principal recipients of the Global Fund. One of our flagship projects being funded by Global Fund is that of the Orphans and Vulnerable Children. And since 2007, we have been involved in partnership with sub-recipients to implement OVC programs in Nigeria. Initially, we were working directly with Federal Ministry of Women Affairs and Social Development and their counterpart state representative. In addition to that, we had other partners who worked with us, Association of OVC Organizations in Nigeria, CISAM and NEP1.
The Association for Reproductive and Family Health is the principal recipient responsible for the implementation of the OVC component on the current GFATM Round 9 Phase 2 HIV/AIDS grant, which runs from 1st January 2013 to 31st June 2015.
The Global Fund project began in 2007 in Akwa Ibom State. The Global Fund OVC project has not only impacted on the vulnerable children, but that it had also provided a platform for building of capacity of our staff.
During the OVC implementation period, ARFH, in partnership with AONN, CSHAN, Ministry of Women Affairs and Social Development at the federal and state levels, and 36 CBOs implemented the OVC SDA in 12 states across the 6 geopolitical zones in Nigeria. These include Bauchi, Benue, Kaduna, Kano, Gombe, FCT, Abia, Anambra, Akwa Ibom, Bayelsa, Ogun, and Lagos State.
The Global Fund OVC project has been complementary to the government in that it has assisted those children who are orphaned by HIV in the state to have hope for tomorrow, because it has made education interesting for them. When they are comfortable in school and have those basic things that are needed, it makes education very, very interesting. And I want to add that the state government, in her own capacity, has gone ahead to provide in the budget for this project. So it is not just what is expected to fizzle out, but because there's provision right now, and this provision will make the caregivers to be able to function even at the local government areas. And we hope to establish child protection committee and alert centers in the various local government areas.
The Global Fund OVC project is a very large project, and it has strengthened the capacity of our staff, that's at government and federal government level and at the state level, and then some of the community-based organizations. It has assisted in providing a very comprehensive service to orphans and vulnerable children in Nigeria. The Global Fund is one of the states that assisted the ministry in developing the state plan of action for the national priority agenda in Nigeria. Global Fund provided technical assistance to the 12 states that they are working with in the Federation in order for them to develop their own state plan of action.
In totality, AON was able to serve 8,000 children on the project. We provided services to 8,000 in the area of psychosocial support. In terms of the health screening, we had 7,192 children, and we're able to provide educational support to 5,190 children in total. Out of these, 38 were in exam class, that is a senior class, and they came out, and some of them have very fantastic results. Courtesy Global Fund, because Global Fund has been there for them to ensure they completed their education. And also we had the nutritional support for the under 5s. The under 5s that was supported on the project was 2,572. These are children aged between 0 to 6 months that were provided with infant feeding. 6 months to 1 year had another set of feeding, and that was commensurate with their age. And also we had 2 to 3 and 3 to 5 being provided with NAN3 and action meal per se. We had to introduce the action meal and infant formula to supplement whatever nutrition we're giving to those children.
One of the outstanding successes of the Global Fund OVC project in Akwa Ibom State is the block granting scheme in the local government area. In this case, particularly in the community secondary school Ibiakuitam in its local government area. We have seen that the children had been provided with lockers, which we could, actually point at. They provide them with lockers, and the caregivers are doing their job effectively by making sure that these children are not exposed to such demands as coming from the schools at times. We run a free education program in the state actually, but there's this demand that parents should be involved by making sure that their children have lockers. So this has been provided through the Global Fund OVC projects.
I must compliment the efforts of these community-based organizations or even the mission institutions managing OVCs across the nation. We build their capacity to help to identify, locate, and provide comprehensive services to OVCs in their specific region of the country. For example, the type of services they were providing include psychosocial support, for which we have trained all the leadership of the CBOs. In addition to that, they link the OVCs to healthcare centers where they can have qualitative healthcare services at no cost at all. But most importantly for me, I think the block granting that we have initiated recently to mitigate some early gaps that we identified in the program has been very effective, because this reduces stigma of these children in school. In addition to that, the block granting allows the school authorities to use those resources for major needs within the institution itself. I think also for the program, we have been able to mobilize the community, because most of these children live in communities and families look after them or do not look after them. In some cases, mobilize the community to take responsibility for these children. And we have community protection committees to ensure their security and to help to mobilize local resources to meet their peculiar needs, both for health reasons or to support them in nutrition. Nutrition support had always also been provided through this program itself.
Well, since this project OVC program started, because when this HIV problem comes to this Akwa state, people used to fear, stigmatize all this. So if they see anybody that have HIV, they will run away, they will not meet the person. They will be scared about the person. When I see people with that problem, having children, some of them, they will not take their drugs, some of them die and leave their children. I will go visit them and take them like my own children. So many things that this Global Fund supports this OVC they are trying very well. So I thank God so much for their efforts that they do to this community, because so many people are stranded. They are looking for a way for them to cope. But well, I thank God for everything. So Global Fund is doing well for their support, for their giving the children action meal, use some school uniform self. They will go to their school and pay their school things like that, like handwork, all those things like that in the school. The principal will welcome us very well, like the one we went last 2 months ago. We went and paid their sportswear and other things like that in the school. They were so grateful about what they are doing. So I thank God so much for their ability that they do to the community.
Global Fund project has actually done what other people will not do. Like in terms of the house services that we actually provided, what other organizations or other projects do is actually to ask you to get the children tested for HIV, so that they can just get the number of people that are infected in the state, because they actually just all they care about might just be the number of people that are infected, so they don't want to get the result. Maybe they used to do their data. But in terms of these projects, they went further than that. They actually do not just provided services like the test for children to ascertain their health HIV status. They went ahead to also look at the genotype, the blood group, and I think the malaria test was also provided too, so that you don't just look at like what other projects you just want to get the number of people and get their target or whatever, but now they also look into what some other problem that might be bothering the children. They know that the child will need to know his genotype, they know that the child will need to know his blood group, so they also make sure that these services are also provided. We will also help a child to know how to live his life. Now I think apart from that, there's area of nutrition that we also provided. I think there are some cases where nutrition services are being recorded as maybe if you talk to a child about, if you tell the child about you should eat vegetables, nutrition and stuff like that, at the end of the day it's recorded that this nutrition services has actually been provided for the child. But in this very project it was different from that because we went ahead to provide NAN for the 0 to 2. Now we went ahead to provide action meal from 3 to 5, and they actually provided some other foodstuff for the children actually when we started the project. But I actually want to talk about something that actually struck me here, because there was a child that immediately after the mother actually gave birth to the child, the mother eventually went mad, and there was actually nothing anybody could do. So the only thing that served then as the breast milk for the child was the infant formula that this project actually provided.
I must commend government's efforts from point of view of policy framework that are in place. For example, the Child Acts, which is in line with the UN Convention for the Rights of the Child. We've also developed some strategic plan to manage OVC cases in Nigeria. We've done also mapping of OVCs across the nation. In addition to that, I believe we have other policy statements which need to be backed up with adequate funding for effective implementation. I believe this project has achieved extremely well. I mean, without, of course, the support of donors, we wouldn't have achieved this at all. Here, I want to make reference to Global Fund that has provided most of the resources, but also I want to recognize the contribution of USAID that has provided grants, for one of the ongoing projects in Lagos State, Akwa, Ibom, and River State. I think there are other sources of funding as well that needs to be acknowledged. But in terms of going forward, there's the global recession. Nigeria is now a lower middle income country. That also implies that less aid will be coming to Nigeria. And this is the time for us internally now to think innovatively about how to leverage resources for these unfortunate vulnerable children. I think we can start with the government recognizing that this is a priority need. You cannot compromise on qualitative education for these children, otherwise they become miscreants, and they may be responsible for some of the antisocial behaviors when they grow up. I think in addition to that, we need to leverage from the private sector. We need to leverage from the private sector through public and private sector initiative to mobilize resources to support these children. I mean, an extra naira on every phone call, or a few naira on extra airline tickets, will provide the resources needed to meet the needs of 17.5 million orphans and vulnerable children, so that they become useful not only to themselves but to the nation as a whole when they do grow up. I'm hoping that government will take initiative and recognize this as a priority group of citizens that must be supported physically, nutrition-wise, and to ensure that they have access to free qualitative education for both boys and girls, even up to the secondary school level.
Moving forward, the federal government we've spoken to the state ministries of women affairs, and at the local government we've gone there on advocacy to try and let them know that as the project is living, there shouldn't be gap. Those children should be catered for, and we're hoping that at least some of these development partners will take over where the Global Fund project has left for continuity and sustainability.